Hi, my name is Dion Williams, and I'm a training and development specialist here with the Office of Unified Communications. In honor of EMS Week and honoring those of our partner agency, the DC Fire and EMS Department, I would like to present a small presentation on controlled bleeding and the ALS links to survival. The focus is to preserve life and recognize the immediate response to bleeding and what constitutes life-threatening bleeding and the appropriate ways to stop and control bleeding. The ABCs to survival first start with A, alert. Call 911 yourself or tell or send someone to call for help. Alerting 911 will notify emergency medical responders the need for ALS care. B, find the source of the bleed. Finding the source of blood loss is extremely important. Internal bleeding is often the result of trauma or an injury. C, compression. Direct pressure can possibly stop major arterial bleeding. Apply continuous pressure with a clean cloth. Do not remove. Apply additional cloths on top if needed until emergency medical responders arrive. Here's an example on how to apply firm and continuous pressure to a traumatic bleeding area. There are three types of bleeding and how to stop them. First is arterial bleeding. It carries oxygenated blood away from the heart towards internal organs. The oxygen is then absorbed while the veins route depleted oxygen blood back to the heart. Venous bleeding carries deoxygenated blood back to the heart. The blood pressure in our veins is lower of that in our arteries. Trauma to a major vein may cause blood to ooze rather than spurt. Capillary bleeding. Capillaries are the smallest blood vessels in our body. They exist close to the surface of the skin, inside our eyes and lungs. Capillary bleeds are normally superficial and easily managed, but all three are treatable by applying continuous pressure to the wound with a clean dressing, cloth, or even our hands. Here are the principles of scene safety. Before rendering help, ensure the safety of yourself and the patient. Initiate care when it's safe to do so. Protect yourself from blood-borne infections by wearing gloves if applicable. Emergency responders should maintain clear communication with dispatch to ensure scene safety for all bystanders and emergency crews. They should also begin to assist in rendering ALS care to identify life-threatening bleeding. This message here is brought to you by the Office of Unified Communications.